At least it's a demonstration.
Very good.
Yes.
So, okay, so you come in the room, everybody knows the 8-it thing, introduce yourself, and then are we verbalizing vitals or are we doing vitals? That was a question for a lot.
You can verbalize it.
Okay, so we verbalized that I checked her identification and I did all her vital signs. And I'm going to be doing a head-to-toe assessment on you today. It could take up to 45 minutes if you got stuff wrong with you. Otherwise, it'll be really fast. So, I'm starting at the head, and I'm just going to check her head for symmetry. And I'm going to be looking for lumps, bumps, lesions, critters, dandruff, all that stuff. When I walked in the room, I forgot that, the general appearance. I'm going to be looking at her nutritional status, her dress, her hygiene, all of that stuff that you can see when you first walk into the room. So then, fast forward back to where I was. So I'm looking at her head, looking for symmetry, lumps, bumps, lesions, dandruff, critters. Then I'm going to move, while I'm already touching her head, to her ears. Is there any tenderness in your ears? No. Any tenderness when I'm moving like this? No. Okay, I'm going to ask her to occlude one side by pushing and wiggling. I'm going to whisper a word in this ear.
Katrina.
And that's the gross hearing test. And I would do that on both sides. And then I would also take the tuning fork and hit it against something and put it on top of her head. And then put it here. And then when the sound stops, that's the Weber and the Rhines test. It's in the book. I don't have the pages memorized, but so you can look that test up. And then head, ears, eyes. So then I'm going to start looking at her eyes. I'm going to take my light and check the pupil responses with the light in both eyes. And so they're reactive to light. Then I'm going to have you look at something and look at the wall to test for accommodation and bring it in for conversion. And then I'm going to hold the same ocular light, what is it, fundoscope? Ophthalmoscope. Yeah, for the fundoscopic exam. And I'm going to do the cardinal fields of vision, and that tests cranial nerves 3, 4, and 6. And I'm going to do the Snellen chart at 14 inches, and that tests cranial nerve 2. And then I'm going to take the ophthalmoscope and do opposite eye and look into her eye and look for the optic disc and optic nerve.
Let her finish and then we'll answer questions. I want her to train it.
Then I'm going to have her look up and I'll look at her sclera and everything in there, the conjunctiva. I don't see any discharge or any crusties. And then I'm going to go to her nose. I'm going to have palpate the sinuses above her eyes and the one next to her nose. Is there any tenderness there? No. I'm going to have her block one side of her nose and breathe in and switch. Her airway is patent. I would have her sniff something for cranial nerve 1. And then I would take my flashlight and look up in her nose and see there's no nasal flaring or anything like that, and see that it's pink and moist inside. And then I'm going to have you clench your teeth. Yeah, and then open and close your mouth. TMJ and cranial nerve 5. And then you can use your Q-tip and poke and use the soft side for sharp and dull on this side of your face, also for cranial nerve 5. And then I'm going to have her open her mouth. Stick it out your tongue, cranial nerve 12, and move it side to side, cranial nerve 9. Open it up again. I'm looking at her teeth. Her mucosa is moist and pink inside, and then cranial nerve swallow. And the gag reflex, cranial nerve 10. And then I'm going to check her lymph nodes, starting pre-auricular, post-auricular, occipital, submandibular. I'm not trying to block anybody, I'm sorry. Submandibular, subtonsillar, submental, and then the cervical chains. There's supracervical chains and deep cervical chains, and there's like 4 cervical chains, and then the supraclavicular. Any tenderness with any of those? No. Yeah, and then I'm going to palpate her thyroid and check for any swelling and have her swallow. Then I'm going to have her turn her head. She's going to be laying back at 30 degrees on the bed in the semifallars, and I'm going to look for, give me the word? JVD, but bounding. If it's bounding, I'm going to measure it from the point where it's at, from this clavicular notch, and it should be less than 4 centimeters. And then, I'm going to check her carotid pulse with the bell of my stethoscope, right? And if I hear a bruit, then I'm going to feel it for a thrill. And then I'm going to put on my stethoscope. I have it up here, but I don't plan on using it. And then I'm going to go left bilaterally, like a ladder, all the way down, listening to her lung sounds. And while I'm in the front, I'm going to check, aortic, pulmonic, tricuspid, and mitral valves for her love dub, S1 and S2. And then on the rubric, you have to have the person sit forward or lay on their left side and listen to the mitral valve again. That way you can pick up any murmurs or anything like that. And then I'm going to come around to the back side, but just turn around so that they can see.
Mm-hmm. Turn around, Mary.
And you have your hands here, and have her take a deep breath. And you're just watching your fingers for symmetry. Do it again. To see that when she inhales or exhales, that your hands stay symmetrical. And then you're going to do for tactile fremitus, have the patient say 99. 99, 99, 99.
What is that?
And then you're going to listen
Red
to the
rum.
same fields that we listened to last semester. Listen for lung sounds, clear bilaterally. And then while you're down here, you could check kidneys. I don't think that's on the rubric. Turn around again. And percuss the back also. And then percuss the front also. And have you lay down? Huh? Oh, yeah. I should have asked her 3 questions. They were giving her 3 words to remember at the beginning of the exam. But you can throw that in there anytime. So, blue, cat, and car. Remember those. And now that I have her laying down, I'm going to go this side. We're going to go on to the abdomen. You're going to listen first, so right lower quadrant, and all the way around, listen to all the quadrants. If it's loud, then she's probably hungry. And then light palpation and deep palpation and rebound tenderness. And then you want to percuss. You should hear resonance, except for over the liver, and it should be dull. And then you could check for the spleen. You shouldn't be able to feel it, but if you do, that's obviously a problem. And then the whole time I've been looking at everything, I'm also assessing the skin for any lumps, bumps, lesions, stuff like that. Then in the abdomen, you want to look for tenderness, rigidity, distension, and pulsating masses, stuff like that. Okay, don't see any of that stuff. Sit up, please. Then I'm going to have her do head ear, eyes, nose, throat. I'm going to look at her skin all the way down her arms. And I'm going to get to her hands. I'm going to check her pulses bilaterally. And while I'm checking pulses, I can take a knee and check her dorsalis pedis pulses and her popliteal pulses. I think that's all the ones that are on there. Mm-hmm. And then I'm going to do musculoskeletal. So I would have her push up and pull down. And, shrug your shoulders. And maybe do your head side to side, because I forgot that in the neck, but I'm just going to throw it in there with musculoskeletal. And all the way around. All the way around. And test your strength in the shoulders. And that's cranial nerve 11. And then I would have her do range of motion in your arms, wrists, and elbows and stuff like that. Same thing with your legs. Lift it up and out and back and down. Same thing with your ankles around. Okay, range of motion is good. Then we're going to get out the reflex thing and check the reflexes here, here, biceps, here, and then the back of the foot, there. And neuro, what's the 3 words I asked you to remember? Say car, cake. There you go. And
Cat.
am I missing something?
Basketball?
Oh, yeah, the walk you said?
Yes, that is.
Yeah, so I'm going to have her get up and walk 3 steps this way. Regular, just watching her gait. And then when she turns around, walk on your tippy toes. And turn around and walk on your heels. And then you can perform the Romberg test for balance at that time while you have her up, or have her walk to the scale. Or, yeah, and then have her bend down and check her back for scoliosis. Am I missing anything on the thing?
Guys, did she miss anything?
Which one? Oh, I didn't do fingers. I know I got in trouble first semester for
On the
not
back,
having.
range of motion on your back.
Oh, okay, range of motion on your back. Well, I'll take those 5 points.
Good.
Yeah.
Would you, does it say that in your rubric? I don't have my